First thing I want to do is say, I have several tough acts to follow. Amazing job, Anthony, Phil. Cindy, we need to save you for last next time. Get everybody fired up and send everyone out into the world. Cindy, you were talking a lot about threats, and I'm going to talk a little bit more about what our opportunity is to change the story and to share our message. So I'm going to talk about the human-animal bond, and I think it's important to have the human-animal bond in mind. So this is the American Veterinary Medical Association definition of the human-animal bond that most people rely on when they talk about it, and it is the mutually beneficial and dynamic relationship between people and animals that is influenced by behaviors considered essential to the health and well-being of both, and the bond is beneficial to the mental, physical, and social health of people and animals, and it's that bond that HABRI studies. But before I tell you a little bit more about our organization, I want to talk a little bit more about your organization. So this is the mission. Patty shared it earlier today, to improve animal care and well-being, to strengthen the human-animal bond, and protect the ability of people to keep animals in their lives. I actually want to focus on this part of the message and kind of flip it around and say, maybe we can protect the ability to keep animals in their lives by strengthening the human-animal bond. And that's kind of what we're all about. So it's all there in your mission. I just rearranged it just a little bit. So before I get into that topic, I want to tell you a little bit about the Human-Animal Bond Research Institute. By the way, you got it exactly right. Call it whatever you want if you write us a check. So we envision a world where everyone understands that pets are essential for our health. How many of you ate some vegetables at lunch, right? You ate your vegetables because it's part of being a healthy person. Right? And maybe some of you got some exercise, at least walked down the hallway. Maybe went for a swim in the pool or went to the gym, and you exercise because it's part of being a healthy person. Well, having pets is also part of being a healthy person. Eat a salad, go to the gym, get a pet. They all belong on the same list. And we have the science to show it. So we first do science, good, and I'm going to talk about some of the projects we're funding. And then we educate people about it. And then advocacy. We're going to talk about advocacy and how we can share the science of the human-animal bond and how that helps us sustain pet ownership. These are the companies and organizations that provide support to the Human-Animal Bond Research Institute. I want to acknowledge Vic Mason, one of our board members here in the room. Dr. Angela Hughes from Mars, they're also represented on our board. But really, we bring together pet and vet and insurance and distribution and nutrition and kind of that broad swath of pet care in support of this mission. Some of them just support us because we're helping bend the curve when it comes to the success of the industry. It's a corporate social responsibility, but it's also a strategic investment in the growth of the future, right? When you see these analyst reports, they're all now pointing to the human-animal bond as one of the reasons why we're going to have a bright future for pet care. And I with all due respect to the threats, I think we can have a bright future. So we have 57 studies. We fund research every year. I'm going to talk about some of the most recent ones, and we're using that to impact policy. So the other side, as we've been hearing, doesn't really rely on science, and I think the stories that we tell and the expertise that we have when joined with the science is the winning formula. So there's still plenty of room for emotion, but we got to have the science built into all of this. So we've taken this research and we've formed things like the Pet Inclusive Housing Initiative to make more homes for pets. We're talking about pets at work. We're even helping through our Pet Giving Network organize pet companies to help in natural disasters. So we're acting upon the science. Last time I was here, I rolled out some of the greatest hits that the American Heart Association had endorsed pet ownership for better heart health. I think since the last time I spoke to this group, it was before the pandemic. I think we all know how important our pets are for our mental health, especially after the pandemic. And there's good science to show that. In fact, this one study that I've cited here that says pets are absolutely essential for the long-term management of mental health conditions. So they're not just nice to have. They're really important for us. And then pets in the classroom. These are a lot. There's cats and dogs, but a lot of small pets can improve empathy, pro-social behavior, and even improve academic performance just by having a classroom pet. And we funded a study with pets in the classroom. By the way, Pets in the Classroom, just in case you don't know about this organization, will actually subsidize a classroom pet for a teacher. They'll provide vouchers and other information and other support to actually get pets in the classroom. So point your teachers at that. We're taking all of this content, we're turning it into something that's shareable for social media, something that's available to all of you. You can find all of this on the HABRI website. And I should say, Patty, I'll leave this on the machine here, and you can share this deck with anybody who you want, anybody who wants these slides. And increasingly, we're finding an appetite for this content internationally. One good thing from AI is that the cost of translation has come down, and now we're really able to share our content around the world. And we've actually done one of the larger surveys of pet owners in 10 different countries. And so if you thought that the human-animal bond and our love for pets was just a U.S. thing, that's not true. It's true all over the world, and so we need to share our message. As I mentioned before, we do a request for proposals every year, and we receive from all over the world, really, research proposals to study the human-animal bond on child health and development and healthy aging and mental health and well-being. And I'm just going to share, this is going to be a two slides because they didn't all fit on one. These are the projects that we funded just this year and last year. And I'm not going to read them all, but I just want to pick out a few highlights. We're taking the next level of research on studying the importance of service dogs for veterans with post-traumatic stress. For the University of Surrey is using AI and big data to really understand who can most benefit from the human-animal bond. I love the Oregon State project, which is going to be training adolescents who sometimes fall away from pet keeping to do a cat training program. And it is hoped that many of these young people will become therapy animal handler teams with their cats. We need more cat therapy animals. And I'll say that the University of Liverpool is going to do the largest study ever on the impact of small animals on our mental health and well-being. Colorado State is looking at the needs of people with cancer so that they can keep their pets with them during their cancer journey. We know how important that is, and I'm sure that there's many stories associated with that as well. The Ohio State is looking at equine-assisted therapy for victims of trauma, and we're going to be looking at both the welfare of the horses and the people involved, and we're going to be looking at how pets can help military kids who move around a lot and sometimes need some additional support. So that's just a few examples of the kinds of projects we're funding, but you could see what a variety there are, and each and every one of these is a building block to show that pets are absolutely essential for our health and our well-being. Pets aren't nice to have, pets are essential for our health. So we're increasingly doing other kinds of research too. And I'm not going to talk about all of these, but I'll just say, and these were all sponsored. So Banfield Pet Hospital actually funded an economic study to show, and I'm going to actually take you through that one, to show the healthcare savings that result from pet ownership. With Zoetis, we did that large 19,000 pet owner, 10-country survey. Petco Love, we did the largest survey of pet owners of color. I think it's really important to know that regardless of culture or community, the human-animal bond is incredibly strong. One of the things we found, by the way, since we got a lot of breeders in the room, is that black pet owners were not always well treated in the shelter environment. And many of them turned to breeders to get their animals as a result. So if you're experiencing discrimination sometimes, well, no, I'm just going to go out, I'm going to get the animal I want. So I think it's an important message to you to know that you should look for diverse clientele and make sure you're serving them very well, and that's what our data shows. We're going to talk a little bit more about housing later on, but again, we need to get the pets, and the pets need to have homes, right? If we don't have enough places that allow pets, especially in rental housing, people aren't going to get the pets. So housing is a real bottleneck, and we'll talk about that in a minute. And then we're looking at pet-friendly workplaces, and it turns out HR professionals are not resistant to pet-friendly workplaces. But let's go through the economic study, because I think, and by the way, it's the full paper. It's about 25 pages, and it can be found on our website. But I'm just going to hit the highlights for you. We were able to show a $1.8 billion healthcare savings from reduced loneliness, and this was specifically Medicare savings for seniors, because we know that loneliness is associated with all kinds of poor medical outcomes. So 1.8 billion, and I'll show you the tally when we get to the end. 4.5 billion in reduced obesity. And so this is a good one to show how you make this calculation. So there's good studies to show that people who walk their dogs 5 or more times a week are statistically less obese. We know how many people have dogs. We actually know how many people walk their dogs 5 or more times a week. And we know what the cost of the average cost of obesity treatment is. So you can then have all the things that an economist needs to make this calculation. 4.5 billion in savings to the healthcare system. 672 million in savings for child mental health. And by the way, just to show you how conservative we were with this analysis, this study that we were looking at showed a reduction in diagnosis of anxiety, children ages 8 to 10. So instead of extrapolating this to all children, and it's probably true for all children, we just limited our calculation to the healthcare cost savings for children 8 to 10 years old. So the savings here are likely very much really higher. 90 million in infection prevention. It turns out that especially seniors who are in institutional settings get infections, and if they have pets, they get fewer infections, and that saves a lot of lives and a lot of money. 688 million in support in savings for veterans with post-traumatic stress, and again, I think this number is probably a lot higher, but we were very conservative with it. And this is the big number. There are several studies to show that pet owners actually visit the doctor less often, anywhere between 0.6 and 1.4 times fewer doctor visits per year, because it's a good indication of general overall health. We used the 0.6, we used the most conservative number, and got 15 billion in savings. And if you add it all up, 22.7 billion in savings to the US healthcare system. When you're talking to lawmakers, when you're talking to politicians, some of them who only understand dollar signs, we actually have some dollar signs we can show them when it comes to the benefits of pets in society. Now, what does the public think about all this? And how does it affect their behavior? When I'm presenting this to folks who develop products and services for pets, this is music to their ears. So first of all, 96% are saying that pets are family, and that 83% there is the ones who strongly agree. And it's not pets are part of the family, it's pets are an important part of my family was the question. It's getting to the point where this might not even be a great question to ask because it's always in the high 90s at this point. Everybody says pets are family. 87% said pets had improved their mental health. This was up significantly after the pandemic. And 97% knew of at least one scientifically documented health benefit from having pets. So we're getting there. But you can see that, classroom learning is only at 44%. But usually the mental health benefits are what people think about when they think about knowing about the science. And why is it important to know about the science? Because we asked this question: if you knew more about the science behind the human-animal bond, how would that change your behavior? Well, they'd be more likely to go to the veterinarian, maintain their regular checkups, take better care of their pet, and spend more money overall on their pet just by learning about the science. So we're here talking about how pets are good for us, and then there's this amazing halo effect that takes place. We're going to take better care of our animals. And we can even bend the curve on pet acquisition. People said that they would more likely to recommend a pet to a friend or family member, get another pet in the future, or even get an additional pet. Now, I will point out that in this survey, in our survey, 54%, I think it's now up to 60% of people have more than one pet. So these are people with more than one pet already saying they'd get yet another pet just by knowing a little bit more about how good they are for us. Isn't that amazing? It also creates more engaged pet owners for travel, for workplaces, for housing. Now, you want to talk about a good question to ask. Change jobs, change housing so that I can better accommodate my pet. These are real life changes that people will make to accommodate their pet ownership. So this is how strongly people are feeling out there. They also said that hospitals and schools and nursing homes should have therapy animals, that the government should make it easier for veterans to get service animals, that emergency and temporary housing for victims of domestic violence and for people who are homeless, that we should really accommodate pets for them. There should be fewer restrictions on pets overall. And so we have strong agreement with this. And how do we square that with some of the threats that we've been talking about? The fact is, the public is just, they're on our side. They get it. They love pet ownership. It's up to us to really talk about it and maybe talk about it in this context. And in fact, you know, we always imagine a day when doctors are prescribing pets. Is it here already? 1 in 5 have had a pet recommended to them for better health by a doctor or therapist. 1 in 5. This is already happening out there today. If science demonstrates that the human-animal bond has a positive impact on our health, and the human-animal bond is experienced by so many people and growing, then really we should be thinking about how we can use all that information to support pet ownership and boost both personal health, and I would argue it's a wonderful public health strategy. We're going to hear from a public health expert next. So I want to take it one step further. So we're in this unique position to sustain and grow pet ownership. Grow pet ownership. We've been talking about shrinking pet ownership. I think we can grow pet ownership, and this is the way we're going to do it. We've been talking a lot about number 1. The human health benefits of the bond are indisputably vital to our mental and physical and social health. This is for individuals, for families, and the communities where they live. So that's number 1. We spent a lot of time talking about this. Number 2, based on these universal health benefits, the ability to acquire and keep a healthy pet should be an equitable right for all. An equitable right for all, and this is really where you come in, right? There's not gonna be enough animals, there's not gonna be healthy pets without the people in this room. We absolutely have to make sure that everybody can get a pet. If they want one, they should get a pet. And then number 3, if we're going to tell everyone they should have a pet, we need to make sure that they have the nutrition and the housing and the veterinary care and everything they need to make sure that that pet has a wonderful life. So this is where pet health and welfare comes in. But I want to spend a little time talking about the people in this room know a lot about number 2. So I'm going to talk about number 3 on this list a little bit, and that's where policy comes in. So I look back, and when I was here, before the pandemic, we said we would love to pass a bill to help domestic violence shelters become pet-friendly. And shortly after I appeared at this meeting, we formed a coalition, and at the end of 2018, we got it done. We actually included the provisions of the Pet and Women's Safety Act in the Farm Bill of 2018, and since that time, the federal government has spent more than $15 million to help domestic violence shelters become pet-friendly, and we're hoping that that continues. When I was here last time, we said we wanted to pass the Pause for Veterans Therapy Act, which would establish federal program at the VA, and they did it in 2021, and it's established a $10 million pilot program. So we got the money for domestic violence shelters. We got the money to help veterans through the federal government. So what do we got to do next? We have to take on housing, and these bills probably won't do it all by themselves, but they're a start. And here's some statistics from our survey. We talked to renters in urban and suburban housing, because we didn't want to talk about a lot of farm dogs. And so it was urban and suburban. 33% of people in rental housing who were limited to 1 pet said they would get a second pet. And 35% of the people who weren't allowed to have a pet in rental housing said they would get a pet. And if you just apply that to the number of apartments out there and the number of people, you can extrapolate that to 8.5 million new homes for pets. So taking on housing in your local community, taking on the issue of making sure that rental housing is pet friendly, without breed restrictions, without weight restrictions, and preferably without restrictions to just 1 pet, at least 2, we can slowly chip away at this and get pets in housing. If we did 8.5 million all the time, I don't know where they'd all come from, but I think over time we should be able to meet that demand. If we create the demand, we can meet that demand. The Pet Inclusive Housing Initiative, by the way, is reaching out to landlords themselves to make the economic argument that people with pets stay longer, they pay more. It's actually a good business bet to have pets. So we're taking it on from a legislative point of view, but also a market-based point of view. All right, I want to talk to you about the People and Animals Well-Being Act. I know it's another PAW Act, but I mean, you can have 4. Sorry, that's my dad joke. People and Animals Well-Being Act was just introduced last month. This would allow, so how many people know what a flexible spending account is or a health savings account? You might also have them. This is your own pre-tax money that you set aside for medical care, for your prescription co-pays and for your new pair of glasses and your dental procedures and things like that. Well, what if you could spend $1,000 of that for veterinary care? That's what this bill would do, and it would place no dollar limit on such spending for service animals, because we want to make sure service animals are treated differently in this. And so that's what it would do. And so it's just been introduced. This is one of the things that I hope you will advocate for. And just to give you a sense of the scope of this, there's 3.2 million FSAs representing $3.6 billion, and the HSAs represent $123 billion. FSAs, where you have to forfeit the money if you don't spend it, $4.3 billion is forfeited every year. So we're not talking about raising the limits. We're just talking about giving you more flexibility to spend on your animals. And I think what's really been heartening to me is not a single member of Congress or their staff has said, animals don't belong. I mean, this is about human health care. I thought that was going to be an argument that we received, and we're prepared, with our economic study and ways to argue that pets do belong. And then nobody questioned it. Everybody says, heck yeah, that's a great idea. So if we just talk to our members of Congress, get more co-sponsors, and by the way, it's HR 9508. I've already changed my PIN. But that's the 9,508th bill introduced in the 118th Congress. And the 118th Congress is about to be over, so we're going to get this reintroduced again next year, and we're going to all work on it together, because this will inject real money into animal care in a way that will be incredibly helpful. So we're sharing this message, and I want to invite you all to Washington, D.C. For the first time this year, we had our spring policy forum, where we're really trying to bring research, practice, and policy together. And then some of you have attended Pet Night on Capitol Hill, which is just bigger and more wonderful than ever. The sponsors of the PAW Act came and received awards, but we have everything from this year. MetLife brought a full-size Snoopy, so it's just amazing what you'll see there. But we have adoptable puppies, we have therapy animals, we had service animals and veterans. And so we're looking at September 16th for Pet Night, May 13th of next year for our Spring Policy Forum, so we can all come together and deliver this message in Washington, D.C. And I see Bob from the Pet Advocacy Network. They run a great fly-in. So they run the fly-in, and everybody goes to Capitol Hill, and then everybody comes to Pet Night on Capitol Hill, and it's a really wonderful time, so I hope you'll consider it. And I did, even though this may not fit kind of in the advocacy piece, I think it does, because we are advocating. We want to make sure that everyone in this room is animal people talking to each other, right? And we need to make sure we get out of our bubble. And one of the ways we're getting out of our bubble is with the Human Animal Bond Innovation Awards. And we run this at Super Zoo. The World Pet Association is a great host for us, and we all come together in Las Vegas, and we give these awards. These are public-nominated awards in pet-inclusive culture and public service, pet-inclusive infrastructure, and media. And the idea is to recognize people outside the pet space who are doing right by the human-animal bond, which is why the Meals on Wheels, which delivers pet food and supplies and is now even helping people with veterinary care, and the American Heart Association, which is promoting pet ownership for better heart health. And judging by the reception last night, I know a lot of you are familiar with Tito's Vodka. Tito's has a vodka for dog people program, not vodka for dogs, vodka for dog people. And since we gave them this award, they actually became a HABRI supporter. Sesame Workshop has an autistic Muppet named Julia and her dog Rose. They did a whole webinar on the benefits of pets for children with autism and a whole video about Julia, so we recognize that. So these are the kinds of companies and organizations that we're recognizing. So the nominations will open up in the spring, and I hope you'll look out beyond the animal world and help find folks who are doing right by animals so that we can really promote the human-animal bond. And then join us, of course, at Super Zoo and come to our ceremony. So I'll wrap this up, and I'll be happy to take questions also. But I want you to keep this construct top of mind. The bond drives better health for people and for pets. Therefore, pet ownership should be an equitable right for everyone, right? Remember that, share that message. And we have to support the bond with all the things people need to care for their pets. We can't just say have them, we need to say have them and care for them. So take action. I can't hold a candle to Cindy and her fire and enthusiasm, but I do want to. But it's important that we support and share human-animal bond research. Talk about this research that we've been sharing today. It really does open up the conversation in an entirely different way. And work to lower barriers to pet ownership and care out in your corner of the world. And then come together, work together for policy change, right? Make your voice heard, because you have the expertise and the wonderful stories to tell, and you put that together with the science, and it is a winning combination, absolutely a winning combination. So some of you were here when I was here before the pandemic, and I showed some videos, and I don't have a lot of new videos to show, but I want to show an oldie but a goodie just as a way to wrap up before I take questions. I mean, we talked about prescription pets, so what would that look like?
Discover relief from fatigue, depression, and stress. Discover Dog. Prescription strength Dog is the non-harmful treatment that is shown to lower blood pressure and risk of heart disease, prevent allergies in children, reduce stress levels, decrease anxiety and depression, strengthen your immune system, and increase social interaction. Side effects may include talking in ridiculous dog voices, picking up poop, making funny faces, being jealous of your dog kissing other people, pretending your dog has a job and has to pay rent, excessive social media posts, laying on the floor pretending to die to see if your dog comes to help you, having full-on discussions with your dog, feeling guilty if you don't tell your dog you love them before you leave the house, saying bless you when your dog sneezes, calling your dog by names other than its actual name, congratulating your dog's bowel movements. Discover better health. Ask your veterinarian about Dog.
That's how you can find me. That's my email. That's my phone number. And also that's my cat. That's Winnie. And I hope you'll also sign up for the HABRI newsletter so we can find ways to stay in touch with each other. Question right here.
So you mentioned helping with pet care. I'm not really sure if this is a nationwide problem, but in my area we're having a huge vet shortage.
Yes.
Have anybody explored legislation to make certain kinds of care a little more accessible, other than through a veterinarian? For instance, I have a client whose dog had a simple ear infection, and the vet visit was $450. The typical person cannot afford that, and it's a problem.
So yes, the cost of veterinary care has risen faster than the rate of inflation, partly driven by a current vet shortage. So there's a couple of things. There's about 10 new vet schools that are being accredited right now, which isn't going to help people today, but we will eventually have more veterinarians, which should help keep the price lower. There's a lot of free and discounted care programs that are popping up to help people, although, again, not nearly enough. And then you have states like Colorado that have a ballot initiative this year for a mid-level practitioner. And then there are people who are opposed to that who say we should just use more vet techs to the top of their license. So there's a lot of efforts to try and address this. But yes, it is an issue, and that's one of the things we really have to work on as a community. Yes, back here.
We talk about animal rights groups trying to close down dentistry. Are we sure it's not prescription medicine and healthcare providers trying to shut us down? You're making all the people healthy.
Well, you know, if we are effective enough that the drug companies are actually arguing against pet ownership, then we will probably have done our jobs, but I don't think we're there yet. Yes.
With I've heard about the vet schools waiting to be accredited. Who is overseeing that the AR groups are not infiltrating and
They are.
They are?
Save that, we'll talk about that later.
Oh, yeah. Angela's going to talk about that on her panel. Okay, over here. Yes. I can repeat that, sure. So the question was, what about a doctor who might recommend a pet to somebody who has never had an interest in pet keeping or any experience with it, and could that lead to problems? I think is the gist of your question. And so I'll tell you, we funded a study at the University of Georgia, and it was for seniors living alone, and they were all given a foster cat. So you can foster the cat, which means you can give it back if you don't like it or if it doesn't work for you. And a number of these seniors had never previously been pet owners. And so not only did their loneliness decrease and their mental health improve, and this included the people who'd never been involved in pet keeping before, but 97% of the participants in the study ended up adopting the cats. So I recognize that pet ownership is not for everyone. It is not for everyone, but I don't understand those people. But the benefits in general, I think, will outweigh the harms. Yes.
I just wanted to mention that in our community, we have a program where seniors are adopting senior pets from the shelter, and all expenses are paid for and monitored by the shelter. So those dogs, care is not a problem financially, and a senior dog is getting a home with a senior person. It's working out very well.
Yeah, actually, seniors adopting seniors is something that AARP actually pioneered that. Now it's kind of gone all over the country. And I don't speak for the sheltering community, but I will say one of the things they're doing also is trying to prevent surrender. They're trying to provide food assistance and veterinary services and everything they can think of to help people keep their pets so that it doesn't get to surrender. And programs like that are a good example. Other questions? Patty, thank you so much for putting on a wonderful conference. Thank you so much. I really appreciate it.